So still talking about some key components, of all issues that could actually occur to a woman. The next one which we'll be discussing is what as a Mittelschmerz. Mittelschmerz. All right. So for the Mittelschmerz, just so you know, it's a type of pelvic pain. So it's experienced by women when they are ovulating. Do you understand? Right, that's when the egg is released from the ovaries. This is even before menstruation. You get. So just the release of the egg sends a message. So in German, it's known as Mittelschmerz is a word that means middle pain. Right, so it's a type of ovulation pain that occurs mid-cycle of the menstruation of the woman. Do you understand? That's why they call it middle pain. All right, that's why they now term it Mittelschmerz. Right, so it's typically it occurs around the day 14 if you are dealing with a 28-day menstrual cycle, the middle. Okay, so it affects up to 40% of people who ovulate, and it's usually harmless. This is just your normal body, responding to the normal physiological, physiological progresses. Okay, so what it feels like is a sharp, if a crampy pain on one side of the lower abdomen. May last minutes to hours. All right, occasionally, all right, it can even take 2 to 3 days. These are some people that their menstruation is usually out of the world. It can switch sides, usually on one side this month, another month it could be another side. Do you understand? So sometimes they are accompanied by light spotting. Sometimes you might have some 1 or 2 drops on your pants. So why it happens? Follicle growth stretches the ovary surface before ovulation. So there's rupture of the follicle. It will now release on 1 or 2 blood. It now irritates your abdominal lining. That's why the pain is coming up. So also hormonal shift, especially in luteinizing hormone, may trigger muscle contraction. So irritation of abdominal lining, so 1 or 2 twitch. You feel some muscle twitch. Okay, that's what leads to the Mittelschmerz pain. So managing the pain, the woman could rest, heat therapies, warm baths, just relaxations. Sometimes pain relievers like ibuprofen or acetaminophen can help. Right, the hormonal birth control. Okay, so that's just what the Mittelschmerz simply means. Just a little concept.